It is the voice of Indiana County, WCCS 101.1 FM and AM 1160. And we're on the air again with Dr. Eric Nepute as we talk about coronavirus vaccine and all of the issues surrounding it right now. And it's not just here, it's all across the nation. Our conversation brought to you by Marcus and Mack, a law firm representing injured people. Doc, good morning.
Well, good morning this morning. How are you today?
Wonderful, and it's good to have you back with us this morning as we talk about a very, very serious conversation of the vaccine. People are so anxious for it. It's the light at the end of the tunnel, but it doesn't seem like that light's getting any closer for a bunch of people, and that's concerning, isn't it?
It's absolutely concerning. I mean, if you think about what's happening, the fact that, well, listen, as a practicing doctor, every day I just hear from patients, Doc, what do you think? What's going on with the vaccine? Should I or should I not get it? And first of all, it's an individual decision that the person should make between themselves and their doctor. But now when people are going, what's going on? We got 400,000 people that have died from COVID, and we're supposed to have, millions and millions of vaccines rolled out by now. And not only are they not rolled out, they're not available, and the process of getting them seems to be very difficult, if not impossible, for the average person. So my customers, my patients are not only upset, but they're very confused by the whole situation.
Yeah, and there are a number of different issues at play here. Number one, how much is there out there? Number two, how do we get it out to the various states? And then number three, how do we distribute it to people so that we can get it into arms as quickly as possible? It just doesn't seem like anybody's really moving all that fast toward finding answers to those three very important questions.
Well, here's what I'll tell you. In 20 years of being in practice, what I know is this, is that every time that government interferes with medicine, it never works out very well. I mean, I just met yesterday with a group of my doctors that I train, and we train over 100 doctors across the country, and, they're asking us the same questions that you're asking. What do we tell our patients? And right now there's a huge distrust in what's happening right now. I mean, I'm sure you saw the protocols when the emergency authorization utilization came out from the FDA for Pfizer and Moderna. It was very specific on what we had to do. We had to give someone, if they got the Pfizer vaccine, they had a short window of time, between 2 to 3 weeks, to get the second one, and it had to be the Pfizer vaccine again. Well, now they're saying, well, since there's short supply, if you took the Pfizer but you get the Moderna the second time, well, you'll be okay. And that's not what we were originally told, and we don't have any data that supports safety or efficacy of doing it that way. And so not only are consumers upset, but I got to be honest with you, doctors are very upset and frustrated as well, to the point where we're not sure what actions we should be taking currently.
Well, that's a big, big problem. If you cannot trust in the delivery system, and if you cannot trust the people at the very top who are going to be administering this, then trust is such a big issue in medical care. And you've been doing this for long enough that if people aren't trusting that they're getting correct or honest information, then it's going to cause real problems.
You're absolutely correct, and that's why we always go back to the tried and true principles that we know have helped people so far. I mean, there literally are so many research articles that show the benefits of people taking high-dose vitamin D and taking zinc and doing other things to help prevent the infection in the first place, and then early treatment. And that's one thing I want to encourage your listeners is any signs and symptoms going on of flu or cold or COVID-like symptoms, early treatment is the absolute key. And then we need to focus on getting more people less sick. We've got to work on, as a society, reducing obesity, heart disease, diabetes, these things that are treatable and preventable that put us at a high predisposition for seriousness with this infection.
Well, that's one of the things when you were with us before you talked about, that zinc is so important, but it's almost like a cocktail you can take of various items that are out there. They're over the counter, they're easy to get, and they can be real barriers between us and the virus until we get this vaccine in us.
You're absolutely right. We preach about what we call the core four. There are core four nutrients that are major deficiencies that are also major helpers with this specific illness. We know that vitamin D3 is an ACE2 receptor blocker. It essentially blocks the virus from being able to be absorbed in the first place. Some data says by 77%, which is huge. Zinc is another one. Zinc stops the virus from regenerating and multiplying. It keeps that viral load level down. Vitamin C is one of the strongest antioxidants on the planet. And then probiotics, good gut bacteria, because some 80 to 90% of our immune system comes from our gastrointestinal area. And because of the stress we're under and the standard American diet, most people don't have a good functioning GI system. So that core 4 is something that every man, woman, and child should be doing across the planet right now.
And we know that people say, okay, Dr. Eric, put it in a bottle so I can drink it, or put it in a pill so I can take it and get all of them at once. Is that product actually out there?
Well, here's the reality. First of all, no, it's not out there. I mean, we have programs and products that we've recommended that have been extremely beneficial with the core 4 that works well. But the reality is this: health is not just in a pill. It's not in a shot. Getting healthy is a process, and we have got to get back to educating Americans on what health really is, and then we've got to have policies and principles put into place that promotes those health benefits. Listen, I said from the beginning of this, when COVID started, last year, I said Americans got caught with our pants down. We're one of the sickest countries on the planet. Obesity is higher here than almost anywhere else in the world. It's a huge contributing factor. The average American, I don't know if you know this, but 50% of Americans are deficient in vitamin D3, and zinc happens to be the number one mineral deficiency in America. So it just so happens that those are two of the key nutrients that if you have adequate levels in your system, COVID doesn't seem to bother you as much as it does if you do not. So we've got to get back to the basics of what health is, and quite honestly, we need more doctors stepping up and telling us.
The interesting thing is I just had a dermatologist in here last hour, and we were talking about how it's a total health picture. Whether you're talking about your skin health, you're talking about whatever. If you as a person are not pursuing your health goals the way that you should be, it's going to affect practically every area of your medical makeup. And that seems to be what you're saying here as we're thinking about coronavirus, which is so very, very dangerous. Everything that has to do with our health is affected by the choices that we have made.
You're absolutely right. Listen, I mean, health is our most important asset. And I've been in this business long enough to know I've had people come from all over the world and see me and say, Dr. Eric, I would pay any price, travel any distance, do anything to get my health back. And the reality is because most people aren't educated enough to know what health really is. Most people think that health is, in a shot, in a pill, or even in a supplement. And it's not. There's more to it than that. And that's why we've done such hard work to educate the community. We put free videos together for folks and educational programs because doctor is Latin for teacher. All the doctors should be teaching people what health is and how they can truly achieve it.
Where are we going to see those videos and get those resources?
If you go to our website, it's the easiest one to remember. It's freevitamindeals.com. That's freevitamindeals.com. If you go there, there's a program called our T90 program. It's a 90-day transformational class. It's free. I'm giving it to everybody for free. We've had over 1 million people subscribe to it so far. It's a 12-video series that teaches people how to de-stress, how to eat well, move well, think well, really how to be their own doctor and help themselves get healthy again.
Dr. Nepute, put on your crystal ball now, your Karnak the Magnificent hat, and tell me, is this vaccine distribution problem going to be solved in a month, 2 months? When do we finally get this unclogged and get the vaccine out there?
Here's my personal and professional opinion. When government gets out of the way of healthcare and lets healthcare do what we do, let the private practices roll this out. Let's get back to having a relationship between the patients and the doctors. There is a strong distrust now more than ever of government in our country, and I don't see how you can possibly convince a person to take quite honestly, an experimental vaccine if the government's pushing it and not allowing doctors to do what we do.
Are people listening in Washington?
People are listening. It's just a matter of, are they taking action?
All right. Very good. Well, the news is good and not so good, but we have a way to turn it around. Dr. Eric Nepute, thanks so much for being with us this morning.
You're welcome. Have a blessed day.
You too. We'll see you. It is the voice of Indiana County, WCCS 101.1 FM and AM 1160 AM.